Hello everyone, and welcome to this audio podcast. This audio podcast is part of the conglomerate. This audio podcast is part of Alabostics. Shall I storm this audio podcast as part of a storm battle and chronicle. This audio podcast is part of the Ztormish series or edition, and this audio podcast is part of a Storm Alabostics production. In this audio podcast, through this audio podcast, a look at pyelonephritis now, pyelonephritis or PN and additionally in around acute pyelonephritis or APN. So pyelonephritis is generally amongst literature is an infectious and inflammatory process that begins in the lower urinary tract and moves up to and through the ureters, and involving a renal or kidney parenchyma. If it is not treated, if pyelonephritis is not treated, it can cause sort of detriment around renal pathophysiology, including renal hydroplasia, sepsis, and potential risk of tract scarring. The most common one of the most common causative aspects in around pyelonephritis is in around gram stain negative bacteria, with most cases due to Escherichia coli. Other less common pathogens include Proteus, Klebsiella, Pseudomonas, Enterococci, and Staphylococci. Febrile urinary tract infection is an alternative name for acute pyelonephritis in amongst literature and through literature. One of the most serious bacterial, it's one of the pyelonephritis is one of the most sort of dangerous and serious sort of bacterial conditions or illnesses in childhood, in amongst pediatrics and children or young people. In older children or young people, acute pyelonephritis may result from voiding disturbances, including hyperactivity and dysfunctional bladder voiding or emptying. I look now at acute pyelonephritis more particularly. So acute uncomplicated pyelonephritis, acute pyelonephritis, is where there is it can be mild to moderate illness in patients without comorbidity on disease or conditions. The majority of cases occur in females ages 18 years of age to in around 40 years of age, in around acute uncomplicated complicated acute pyelonephritis. Recipients have an underlying condition that increases risk of pharmacotherapeutics, for example, where pharmacotherapeutics do not alleviate symptomologies. Pregnancy, renal transplantation, solid organ transplantation, acute kidney injury, and chronic kidney disease all form challenges in around the functional and anatomical abnormalities in around the urinary or in around the urinary tract, In around now looking at etiology, most cases of APN result from the entrance of organisms through the urethra and periurethral tissues into the bladder, with subsequent invasion of renal pathophysiology. Urinary flow or urinary tract flow usually prevents or precludes infection, washing out bacteria penetrating into the urinary tract. The most important condition associated with acute pyelonephritis is the presence of anatomical renal and tract abnormalities such as a vesico-urethral reflux or VUR. In as part of now looking at chronic pyelonephritis. So chronic pyelonephritis is a consequence of repeated untreated complicated acute pyelonephritis or APN. The underlying underlying etiology is in the main structural abnormalities such as congenital abnormalities of the urinary and the renal and urinary tract, and the presence of sharply delineated geographic scarring. That is where, for example, the urinary tract is generally scarred throughout, owing to the etiology that chronic pyelonephritis and prompts. In as part of a clinical diagnosis, clinicians look at history and physical examination, which are initially are some of the most initial useful ways for diagnosing APN. So, for example, where clinicians look in around the history and physical through history and physical examination. Initially, in around the history, clinicians look in around the lower urinary tract or lower urinary tract symptoms or symptomologies. For example, where clinicians look at frequency, urgency, and dysuria, upper urinary tract symptoms, constitutional symptoms or symptomology, and gastrointestinal symptoms. As part of the physical examination, the clinicians tend to look for fever, cost of vertebral sort of angle tenderness, symptomologies in around tachycardia and abnormality in around ABP. In around the diagnostics, as part of a clinical, the clinical diagnoses of PN and APN. So initially, in around the diagnostics, diagnostic urinalysis is used, and through urinalysis, urine dipstick investigations are conducted. Microscopic urinalysis is conducted, and positive leukocyte esterase tests or investigations are performed, and microscopic hematuria or pyuria with pyuria or white cell casts are important characteristics of part of the urinalysis diagnostics. And then in as part of urine culture, culture, and looking at the characteristics in around urine culture in all recipients with suspected acute pyelonephritis or APN. The investigation or the diagnostics in around urine culture are utilized are utilized to identify APN in suspected recipients. And then secondly, asymptomatic recipients after pharmacotherapy, urinary culture can help identify symptoms and sort of where repeated symptoms are within two weeks of pharmacotherapy use, and urine culture growing more than 10 to the 5 colony forming units per mil of urine is and can be sort of characteristic of the diagnosis. In around radiology or imaging, if symptoms do not sort of improve, or there is a recurrence if there is occurrence, then radiology or imaging is utilized. There have been guidelines previously, although literature in amongst the literature there would be now more sort of more recent literature, or more recent published data that suggest performing or the use of performing a routine renal and bladder or urology investigations after sort of initial episodes of pyelonephritis or acute pyelonephritis, and investigations such as vesicourethrograms is and can be recommended only if, for example, hydronephrosis, scarring, or other abnormalities are detected. DMSA scanning or investigations are not or have not been recommended as part of the radiological and imaging aspects. Excuse me. As part of blood cultures, then looking at blood cultures. So blood cultures, listeners and viewers, is different to urinary cultures. Blood cultures look at sort of the sort of abnormalities specific to hematological detriment. So blood cultures usually are obtained from recipients with acute pyelonephritis who may be unwell enough or ill enough to warrant hospital admissions or hospitalization. Peripheral blood smears that show leukocytosis can be useful. Additionally, sort of almost sort of supplementary is that basic metabolic panel investigations to assess renal function, lipase screening, and transaminase investigations can be can be used for as part of the diagnostics for PN and APN. In around the pharmacotherapeutics or treatment aspects, short treatment with intravenous antibiotics, for example, in literature informs that so intravenous antibiotics are up to 4 days, followed by oral treatments can be helpful. Guidelines for the treatment of childhood or pediatrics or childhood acute pyelonephritis recommend oral where there has been recommendations for oral antibiotics use for the treatments in young people of more than 2 months of age, unless the child or young person is seriously unwell and unable to tolerate oral antibiotics. Oral antibiotic administration is recommended in amongst in what's referred to as outpatient settings or environs. Hospital admissions, hospitalization for intravenous therapies for intravenous therapy or pharmacotherapeutics as part of pharmacotherapeutics is and has been recommended for healthcare in children, young people, and the pediatric population, where in around PN and APN. There is no gold. There has not been sort of a gold standard for antibiotic treatment or pharmacotherapy, and it can vary between countries. Empirical antibiotic treatment should be started soon after acute pyelonephritis is suspected, and antibiotic treatment is and can be used in following data from urinalysis and symptomologies. Steroidal treatment, steroidal therapy, or steroidal pharmacotherapy can be used for PN and APN, and it is used primarily on the basis of precluding sort of tract scarring, or where there is inflammation around the urinary tract. Now looking at the recurrence and prevention. So identifying major risk allows for the implementation of preventive measures to reduce the risk of recurrences and preserve renal function in children and young people. Factors associated with recurrences are for example are associated more associated where recurrences are in amongst Caucasian or white race, age between 3 and 5 years in amongst the pediatrics and young population, and grade 4 and 5 vesicourethral reflux, or VUR. Risk factors associated with recurrence is in around looking at where recurrence has probability, has sort of a high probability, include looking at urinary tract infections and in amongst family history, dysfunctional voiding syndrome, poor fluid intake, and functional bowel and tract retention. Antibiotic prophylaxis can be used to preclude recurrence in pediatrics and young people after acute pyelonephritis, especially when vesicourethral reflux has been detected or identified. Antibiotic prophylaxis has also been associated with an increased risk of resistant bacteria. In around sort of the sort of clinical, in around some of the clinical aspects, symptoms of APN in pediatric and young patients is variable and is influenced by the age of the child or young person, the virulence of the organism, and the inflammatory immune response. The in around the symptoms or symptomologies, there can be a fever, dysuria, malodorous and cloudy, malodorous and cloudy urine, and urinary incontinence. In around pediatrics and young people, less than 2 to 3 months of age, there can be labile temperature, slow feeding and poor weight gain, irritability, lethargy, hypotony, abdominal pain, nausea and vomiting. In around pediatrics, with ambiguous symptoms or symptomologies, there have been literature to inform higher risk of complications such as sepsis and meningitis. And as part of the summary, oral and intravenous antibiotics are equally effective in most pediatrics and young people, in pediatric young people with PN or APN, and prenatal ultrasonography has revealed that major renal damage in pediatrics and young people is frequently related to the presence of urological abnormalities. Antibiotic pharmacotherapies help in resolving acute infections without complications, and additionally, the long-term outcome of APN is mostly related to the appearance of renal scarring or tract scarring. A minority of pediatrics or young people have a deterioration of renal function to what symptomology lead to CKD after an APN diagnosis, and so it is pertinent or important for healthcare professionals to follow up. That draws this audio podcast to a close. This audio podcast as part of the conglomerate. This audio podcast is part of a Labostic Shystorm. This audio podcast is part of a Storm and Battle Chronicle. This audio podcast is part of the Ztormish Series or edition, and this audio podcast is part of a Storm Labostics production.